So shortly after birth, mammals, and we're thinking humans, of course, have their first bowel moments. And this is called meconium. And the first few are very black and sticky and treacle-like. And actually, the meconium consists of lots of different substances that have been ingested within the womb. So, because remember, bowel movements don't occur in the womb as the fetus is fed via the placenta, and the placenta removes the waste products. So that also means that meconium is also usually sterile, as it's not exposed to bacteria until after birth. So some of the things that meconium consists of are things like the epithelial cells, the laguno, which is basically a soft downy hair, bile from the fetal liver, amniotic fluid, and mucus. And as I've mentioned, it is usually sterile. There is a condition called meconium aspiration syndrome, and this is really where the material may block the airways, and therefore the efficiency of gas exchange in the lungs is lowered, and the meconium-tainted fluid is actually irritating, inflaming the airways, and possibly leading to a chemical-induced pneumonia. And this can significantly increase morbidity and mortality if severe enough. So the next stage thing that we're going to look at is uterine involution. And this is shrinkage of the uterus to the pre-gestational size. And it shrinks at about 1 centimetre a day, and it takes about 4 to 6 weeks to occur. And what is happening at this point is the remaining endometrial tissue is gradually disintegrating and sloughing off, producing a vaginal discharge, termed lochia. And the involution occurs because of a couple of things. We've got a reduction in our estrogen and progesterone levels, so the endometrial tissue is no longer maintained, so it starts to die. But also oxytocin release during breastfeeding. So remember, breastfeeding triggers both prolactin, which is milk synthesis, but also oxytocin release. And oxytocin stimulates milk ejection, but at the same time it's promoting myometrial contractions, so smooth muscle contractions in the myometrium, therefore maintaining uterine muscle tone, therefore enhancing involution. So basically, breastfeeding enhances shrinkage of the uterus to its pregestational size. The last little thing we'll talk about is lactation. So of course, during gestation, we have elevated placental estrogen. That stimulates duct development within the breast. We have elevated placental progesterone. That stimulates alveoli formation within the breasts. And prolactin, of course, helps to stimulate the synthesis of enzymes for milk production by those alveolar cells, those alveolar epithelial cells. So if we're having a little look at the structure of the breast, you can obviously see the adipose tissue, you can see the ducts, and you can see the lobules containing the alveoli. And if we take a look in a little bit more detail, now you can see the duct there. You can see these alveolar epithelial cells, and this is where the milk is being made. And you can see these myoepithelial cells, and these are basically the ones that are being stimulated by oxytocin to cause to contract and squeeze milk out of the alveolar epithelial cells. So remember, breasts in the non-pregnant women are mainly made up of adipose tissue and a very basic duct changes. And most of the changes that we've talked about in terms of breast structure and development occur within the first 20 or so weeks of pregnancy. So the breasts are fully capable of producing milk by mid-pregnancy. And as I've already mentioned in an earlier session, the pituitary can triple in size because of the increased number of prolactin secreting cells. So what stimulates lactation in the first place? Well, it's withdrawal of those placental steroids at birth. And that's the withdrawal of estrogen and progesterone. Because remember, they were inhibiting the effects of prolactin on milk synthesis. You remove estrogen and progesterone, and all of a sudden, prolactin can stimulate milk synthesis. And so once milk production begins after the delivery, 2 hormones are essential for maintaining lactation. Quickly, tell me, what are they? Prolactin for milk synthesis, oxytocin for milk ejection. Because immediately after birth, the breast milk actually has relatively little nutrition. It's quite watery, it's with proteins and other things in it. And then over time it becomes more enriched with fats and lactose and growth factors and antibodies. And so remember, what's happening is prolactin is stimulating milk synthesis, and your oxytocin is causing secretion from those alveoli epithelial cells because it's causing contraction. And it's all sustained by suckling. So on suckling, you get stimulation of the mechanoreceptors, as we've already talked about. Those mechanoreceptors generate nerve impulses, action potentials that stimulate the hypothalamus to cause the release of oxytocin from the posterior pituitary. Oxytocin, of course, causes milk ejection, and it stimulates prolactin release from the anterior pituitary, which of course stimulates synthesis of more milk to replace the milk that has been ejected. So suckling causes the release of oxytocin. That contracts those myoepithelial cells. That compresses the alveoli and forces the milk to flow through the ducts. That's your milk ejection. But remember, milk ejection only occurs as long as the infant is suckling. So therefore, it's only ejected when and in the amount needed by the baby. So let's just go through a little bit of a summary here. So we start off with the suckling. That stimulates mechanoreceptors in the nipple, which goes and stimulates the hypothalamus. And through the nervous pathway, it stimulates, is it the anterior or the posterior pituitary? It's the posterior pituitary to cause the release of which hormone? Oxytocin. And what does oxytocin do? Contraction of the myoepithelial cells surrounding the alveoli, which leads to milk ejection. It also causes a decrease in the release of prolactin inhibiting hormone. And because of that, we get, through the anterior pituitary, the release of prolactin, which of course stimulates the enzymes necessary for milk synthesis. And there is your vicious cycle. So the baby likes the milk that's coming out of the ducts, so it sucks more. Therefore, we get this suckling reflex in a positive feedback loop until eventually the baby's full, stops suckling, moves away, and there is some residual milk that is ejected from the nipples, obviously, because of the remaining blood oxytocin levels, causing contraction of those myoepithelial cells. So another review question for you. So which of the following are correct regarding parturition? Press pause, please, and have a little bit of a think. Number 1, the hormone relaxin, which is produced towards the end of pregnancy, causes dilation of the vagina in preparation for childbirth. That's incorrect. It causes dilation of the cervix. Number 2, estrogen stimulates oxytocin receptor synthesis in the vagina in preparation for childbirth. That is also incorrect. Estrogen upregulates oxytocin receptor synthesis in the uterus, in the myometrium, so the smooth muscle. Number 3, oxytocin released from the hypothalamus stimulates smooth muscle contraction. That is incorrect. It is released into the blood from the posterior pituitary. Nasty little question, that one. Number 4, oxytocin stimulates contraction of alveolar epithelial cells in the breast, causing milk ejection. That is also incorrect. It is the myoepithelial cells which surround the epithelial cells that oxytocin stimulates the contraction of.